Hello, in this video, I'm going to explain what beta blockers are and how they work. Beta blockers are a class of medications that are used to reduce blood pressure in all sorts of different cardiovascular conditions. They're sometimes prescribed for people who have arrhythmia, so irregular heart rhythm, heart failure, chest pain, meaning angina, history of heart attacks, migraines, certain types of tremors. So any condition in which control of blood pressure is important and there's difficulty controlling blood pressure through other mechanisms. How does it work physiologically? So, there are receptors throughout the body, but also including the heart, called beta receptors. And those are the receptors that receive the hormone epinephrine and also norepinephrine. For more detail about the different types of receptors and which ones respond to which hormone, I included a link to a video all about that in the description below. Beta blockers act by blocking those receptors so that epinephrine no longer can have action on the heart. So when epinephrine, also called adrenaline, when it acts on the heart, it causes the heart to contract with greater force and it speeds up heart rate. So if we block those receptors, we block epinephrine or adrenaline from being able to have that action on the heart. So it helps to maintain a lower heart rate and also lower blood pressure. So we need to be careful when somebody is on beta blockers. We need to be careful about how intensely we exercise. So if somebody is on beta blockers, what that means is that no matter how hard their body is working or how intense the exercise is that you're participating in, your heart rate and blood pressure cannot exceed a certain threshold. So it's important to keep exercise intensity within the range of your heart rate and blood pressure and what it can compensate or what it can cope with. Because what happens is if your exercise intensity is going up and up and up, your heart rate and blood pressure can't go up and up and up to match that intensity. So at some point, it becomes very dangerous because when you're exercising, you're increasing all of your body's organs and tissues' demand for blood to keep up with that exercise. And if you exceed what your heart is capable of because the beta blockers is stopping you from exceeding a certain heart rate and pressure, if you exceed that, now all of the tissues in your body that require that additional blood flow due to your exercise intensity will not receive that blood flow. Although your blood pressure is under control, it's dangerous in other ways because you're not able to adequately circulate your blood to all corners of the body as needed if your exercise intensity gets too high. So that is the danger when it comes to exercise intensity on beta blockers. So what that means, it doesn't mean that someone on beta blockers shouldn't exercise. They absolutely should, and that's important in the effort to control blood pressure and to improve whatever the condition is that has them taking those medications in the first place. So exercise is absolutely recommended and important for somebody on beta blockers. But what it does mean is that you need to be careful about how hard you're pushing it. No matter how hard you exercise, your heart rate and blood pressure are not going to be able to go above a certain point. So that means that you have to limit your exercise intensity so that you never go beyond that threshold. Now, what is that threshold? It depends on the person. It depends on the medication. It depends how you're responding to that medication. My recommendation to you is that you need to talk to your doctor about that and ask them for guidelines on what heart rate you should aim for or what intensity, or ask them for guidance on how hard you should be pushing it because they know you and your body and your response better than you do or than anyone else does. Since being on beta blockers changes your perception of exercise intensity. They also might do a stress test with you, and that can help you determine what that upper limit is so that you know what that threshold is and where to stop. So if you wear a heart rate monitor during exercise, then you will know here is my ceiling, here's the limit, and I cannot go beyond that. So talk to your doctor and get a recommendation from your doctor. In general, if you aim for exercise intensity that feels somewhat hard, but you can still talk during it, then you're probably in the safe zone. If you're exercising hard enough that you start to feel like you can't continue conversation, then you might be pushing it a little bit too high and you might be in danger of crossing that threshold. Now, be careful when it comes to gauging your own exercise intensity. That's a tricky thing when you're on beta blockers, because when you're not on beta blockers, most of us kind of gauge our intensity and how difficult exercise is by the perception and feeling of how fast your heart is pumping and how high your blood pressure is going. Like, those are things that we can feel in our bodies and that tell us that our exercise is becoming more intense. So when you don't have those feedback mechanisms happening in your body, you need to be aware of that and be careful about how you're perceiving the amount of exertion that you are under during that exercise. So always default to your doctor's recommendations, and I hope this helps you exercise safely on beta blockers. Thanks for watching and have a great day.